Good morning, everyone. Nice to see you. I'm Deidre Gifford. I'm the Commissioner of the Office of Health Strategy. Thank you for being here to talk about a very, very important issue and legislation that the governor is going to introduce in this current session. The bill that we're going to talk about this morning is going to help do three very critical things, and these are things that we've all been reading about in the newspaper of late. First of all, ensure the stability and functioning of our healthcare system. Protect healthcare workers and communities from potentially dangerous business practices. And most importantly, protect patients and ensure high-quality healthcare continues in the Connecticut healthcare system. It seems like you can't listen to the news or pick up a newspaper lately without hearing about some new practice in the healthcare system that is potentially impacting quality of care, affordability of care, and access to healthcare. It's rare that a week goes by, and I know that all of us up here can relate to this. It's rare that a week goes by that I don't get a question. What can the state do about X problem? Why didn't the state intervene before this happened? What can the state do to prevent this from happening in the future? We all know about high-profile bankruptcies like Stewart and Prospect. We know about hospitals that have sold off their hospital buildings and incurred large amounts of debt that then makes it difficult for them to remain financially viable. But as we speak, there are lots and lots of transactions happening that also have the potential to cause harm to patients and workers and communities that the state does not have the ability to review. We have autism centers that are being bought by private equity. Same with hospices and nursing homes. Some of our most vulnerable individuals being cared for by entities that are owned not by healthcare providers. We have out-of-state groups buying up practices in our state without the ability for us to understand or even know about what's transpiring. Many of our statutes have not kept up with these changes in the healthcare delivery system, and that's what this bill is about. Our current law also doesn't allow the Office of Health Strategy to work side by side with the Office of the Attorney General on reviewing these transactions, and that's what this bill would allow us to do. It will give the Office of the Attorney General the ability to also look at quality, access, and affordability, things that are in our purview at OHS, but right now not in the purview of the Attorney General's office. And this bill will establish a joint review process between our two offices. So how would this law work? First of all, the current process that Attorney General has, it's called Notice of Material Change, would continue. The current Certificate of Need process at the Office of Health Strategy would continue. But this bill would allow a much broader range of transactions to be noticed to the Attorney General's office than are currently required. So, changes in ownership, transfers of assets, merging of practices, things that right now are loopholes in our current laws would be captured by this and would be noticed to the Office of the Attorney General. Then, OHS and the AG's office would work together to review those notices. Are there any red flags? Does this transaction have the potential to impact not only antitrust issues, but quality, access, and affordability of health care, things that are very important to the governor, to the Attorney General, and to the state. If there are red flags, OAG and OHS would work together to develop conditions that could be imposed on the transaction, or refer that transaction to our office for a full certificate of need review. So it's a new partnership, it's a new things that we would be reviewing together, and it's a broadening of the types of transactions that we would review. I want to acknowledge Representative Kristen McCarthy-Vahey, Senator Saud Anwar, that we have been proud to work with very closely on all of these issues. We look forward to working with you more this upcoming session. I also want to acknowledge Boyd and the team at OHS, Kara, Nicole, the team at OAG. We've been working very closely together, along with the governor's office, on developing these proposals, and we really look forward to this upcoming partnership. With that, I'd like to introduce the Attorney General, William Tong.
Thank you, Commissioner. And thank you for your leadership on these issues. You're going to hear, you've heard already, a lot of technical provisions, and this is a pretty technical bill. Healthcare is complicated, but at the end of the day, this is pretty simple. This is about patients. It's about quality. It's about access. It's about affordability. It's about families here in Connecticut and making sure they have access to good, high-quality health care, and that there are providers there ready to do that for them. Healthcare changes every single day. You don't have to talk about Prospect and Stewart. You don't have to get there when we already know that there are issues around consolidation in acquisitions of practices and providers and a lot of uncertainty out there. So it's about patients, it's about Connecticut families, it's about healthcare, it's about taking care of people before they get sick and when they get sick. It's about doctors, nurses, it's about jobs and making sure that we have a strong and vibrant healthcare system. So just a little context, about 10 years ago, we enacted the Notice of Material Change statute. That was in response to what was then a series of major transactions or coming transactions that we're really concerned about. And there's a federal threshold under a federal law known as the Hart-Scott-Rodino law. And basically, we had limited ability to look at transactions below the HSR threshold. And so that's the prevailing antitrust federal threshold, the line. And we in the federal government could look at transactions over that line, but not below it. And so in 2014, we were the first state in the union to enact a statute like this. And at the time, we were responding to these big combinations. But now, in the last 10 years, and so, from that perspective, it's been a while, we've seen a lot of different forms of transactions and a lot of changes in healthcare, including what happened at Prospect. A lot of financial engineering, a lot of financial buyers, not strategic buyers. What I mean by that is people who are buying hospitals and practices for money, not to provide better health care. And a lot of structuring. Lawyers are good at structuring. And so there's been a lot of structuring to avoid the Notice of Material Change statute and the process and to avoid scrutiny. It's also really important that this bill bakes in not just the process that we have, and it strengthens the process, but it bakes in the ability of the state acting to the Attorney General to ask tough questions about quality and access and affordability and to impose conditions before any transaction is approved, and that's a really important part of this process. What was a 30-day process will now be a 60-day process in advance of a transaction. So 60 days before, if you fit this now much broader definition of what's covered, you have to let me know, and you have to let the commissioner know, and we get a chance to look under the hood and take a deep dive into the transaction and whether it makes sense, not just from an antitrust perspective, but whether it makes sense for Connecticut and for healthcare and for Connecticut families. And so I want to thank the governor for introducing this important piece of legislation. I want to thank our legislative partners for helping us shepherd it through. There are other bills floating around as well that address these issues, and we look forward to our enhanced partnership with the Commissioner and OHS. Thanks so much. And with that, the Governor of the State of Connecticut, Ned Lamont.
So Deirdre and William and I were here a week ago when Prospect filed for bankruptcy, not just impacting our hospitals here in Connecticut, but in other states around the country. We said then, I repeat right now, quality of care is not being compromised. We have monitors there. We make sure that all the, everybody's being paid on a current basis since the filing of this bankruptcy notice. But we're here to make sure something like this never happens again. And here with the Yale students who are doctors-to-be, welcome. And I think you know better than anybody, the cardinal rule in healthcare is an ounce of prevention is worth a pound of cure. And we're not going to be taken by surprise ever again, if this bill is passed, by some of the financial shenanigans that impacted Prospect Hospital, and when they took a big $500 million dividend out of the hospital, used that to pay a private equity firm, and ended up putting a mortgage on top of these hospitals that's sucking tens of millions of dollars a year out of the operating room, out of clinical care, to pay these, to pay the mortgage. And it's really important that the Attorney General's office, the Office of Health Strategy, have early notice, an early warning system of these material transactions that can directly impact quality of care to avoid situations like this in the future. That's what this bill is all about. They'll be required to notice us if there's going to be a material change like there was in Prospect, and you know, the Attorney General's office, and maybe go over to the Office of Health Strategy with a CON, so we approve this to make sure quality of care is not compromised by any of this. Again, I remind you, these are good hospitals with a lousy financial structure, but good operating hospitals. And right now, my #1 priority is to make sure that we maintain the quality of care for each and every one of the patients. And we're doing with this bill to make sure this never happens again. Thank you.
We'll take on-topic questions.
Well, I got him a little late. Recap?
It's not that complicated.
Yeah, you can read it in the current.
Governor, what kind of role is the state playing behind the scenes right now in the Prospect Yale stuff?
I'll start on that. I can tell you that we're still in, we have to get a bankruptcy attorney, consultant. This is all taking place down in Texas. William can speak to that. We're also talking to Yale and talking to Prospect, seeing what, if anything, we can do to move this process on, make sure we have a good operating entity in there. Maybe you have a, who's going to be taking over those hospitals, see if we can do that on as timely a basis as possible. Want to add to that?
Yeah. So I'm a little busy right now, but for the senior leaders in our office and the lawyers in our office, we spend as much time on this on a daily basis as anything. So we're deep in it. We're deep in the bankruptcy. We're talking to our bankruptcy counsel. We're trying to figure out a strategy going forward. At the end of the day, we are focused on one thing: patients, right, and healthcare, and getting these hospitals, these assets into the hands of a responsible operator who can run these hospitals well.
Attorney General, there was a notice filed in the pending lawsuit between Yale and countersuit between Yale and Prospect that I guess seeks to remove the case to the federal bankruptcy court. I haven't seen an order from any federal or state judge yet that that's occurred, but what's the significance of that move? Because there was some, I think the last time we talked, there was some talk about, well, could a bankruptcy court require Yale to complete the sale as negotiated? It could lower the price and say, okay,
So-
now you guys got to cut the deal.
So my message is that Yale can still buy this hospital, these sets of hospitals. And, you know, it all comes down to price, I'm sure, and the other terms. But I think all of these different moves are moves, right? They're moves by various interested parties and creditors to stake their claim and to get advantage in the process, which is very complicated and very difficult. And so I don't read anything more into it other than Yale's trying to preserve its position.
What I'm asking you is, as an attorney and
Yeah.
as the state's attorney general,
Yeah.
if you know, could a bankruptcy court require this sale to be completed, either as negotiated or under revised terms?
Could. I suppose there are a set of circumstances in which they could. Is it likely? I don't know.
Just so I understand, are you guys at the level of A, you want the deal to go through with Yale, or B, are you seeking outsiders or other people who could buy these
We want a
hospitals?
responsible and effective buyer.
I'd like to see the Yale transaction take place. We've been down on the 10-yard line now for a couple of years. They know what they're getting into. They have argued there's a material change in the operations over the last 2 years, which is why they've asked for a reduction in price. That's part of the dispute between Prospect and Yale. The bankruptcy attorney may weigh in on that as well. And whether Yale is the ongoing operator or there's going to be a new accelerated process, we're going to have a new operator in there.
Just to clarify, you guys are two separate constitutional offices. You're talking about getting a bankruptcy counsel for the governor's office?
No, for the state.
For the state, or both jointly or together?
Yeah, it represents
Okay.
our
Okay, yeah, I just wanted to, wanted to make sure we're
Yeah.
Last
constitutionally on this.
And there's no daylight between me and the governor on these issues. Yeah, we're closely aligned and working very closely together.
Governor, have you talked to the CEO at Yale New Haven recently on this issue?
No, but I think I will.
Well, I mean, no, that was Prospect's deal. No, as it was.
Do you have a time frame on this? I know bankruptcy can be a morass, a big morass, and you guys have been involved in these before. What kind of time frame are we talking? Are you thinking in 3 months this thing's going to be settled? 6 months?
We want to move as quickly as possible. We want to get a process in place for the disposition of these hospitals, for someone to take over and to run these hospitals. And so we just had a meeting about it and talked about how to get there as quickly as possible. You know, I don't know. My hope is that we're talking about months or less than that and not longer.
Governor, I have a chance to real quickly, just recently, and I apologize, I had to be someplace else. I don't see anything outlined here regarding the role of private equity in the healthcare industry in the state, particularly with hospital.
This is just what this bill addresses. If there's going to be a material change, often it's private equity, maybe it's a private operator. We're going to know if there's a material change. We're going to make sure the quality of care is not compromised, as it's been in this particular case.
Can you clarify the benefit of having the Attorney General's office involved? I know that in Rhode Island they were able to say, we'll approve this transaction, but you need to put tens of millions of dollars away just in case something happens. So can you just clarify for us the benefit of that?
Yeah, I mean, I think we've seen in other states that having the Attorney General have a frontline responsibility for the review from a legal perspective, and then in partnership with the Office of Health Strategy with their expertise in healthcare can be very effective. I didn't mention that this now has a penalty provision as well for not complying with the notice of material change statute, so I can bring an action for penalties, and so I can hold them accountable. This has more teeth than the statute has had up until this point.
And then, sorry, can you just outline the process one more time? Is that you'd receive the notice of material
We both
change.
received the
You
notice.
both received the notice of
And then they have
material change.
60 days before the transaction is supposed to take place. And then we have time together to evaluate the transaction, including who the ownership is, who's behind it. That'll sweep in private equity funds and financial buyers. We'll talk. Our teams will figure it out. If I need more time, we'll get more time.
And would this have captured the sale leaseback? Would this have captured
Yes.
the dividend sale?
Yes.
Okay, great. Thank you.
For the lawmakers, are you planning any public hearings on the Prospect mess to air this out?
So there are so many bills around these topics that will automatically happen. There are private equity related bill, the governor's bill, which is actually addressing this in a very comprehensive manner as well. So when we have the public hearing on these topics, they will automatically become Prospect and other hospital and other private equity and other activities that have been happening in our state. So we do anticipate that.
When do you anticipate holding your hearings? I mean, you guys are just voting to draft bills and stuff like that, so I mean, it takes a little.
Yeah, we do already have 2 specific titles, concepts raised for both private equity and certificate of need, and I think it's going to take us a little bit of time to rally together and look at some of the competing proposals related to both of those topics, which are intimately connected with one another. So we don't anticipate it will be one of our first hearings. It will probably be a little bit later in the process.
March, April?
We are at the very end of March.
Okay, thank you.
And I know there have been concerns about timelines on the certificate of need process, and that's something the legislature has considered addressing. Would this new process add to those timelines?
No. And Katie, just to remind you, we have heard concerns about past timeline challenges. The timeline issues have largely been addressed. As you know, we've reduced our timelines for processing these applications by 60%. I haven't signed an extension in a very long time, maybe a year. So we are complying with the timelines that are in the statute. So last year, the 3 of us holed up upstairs for a long time working on a bill that would have shortened some of the statutorily required timelines. We got very close. We got to the half-yard line, didn't quite get it over the finish line, but as you know, we have another agency bill that would address some of the CON expedited processes this year. So I think that those timeline issues have largely been addressed.
Yeah, we're gonna break before we do all. Thanks. Anything else on the topic?
Thanks, guys.
Thank you.
Thank you.
Thanks.